this beautiful Tuesday evening. It is Tuesday, the 15th day in the month of October, year 2024. Welcome back to the Ask Dr. Rita show, and it's so good to be back on the program as well. My name is Amoyemi, and our fine doctor is here again in the building. Good evening to you, doctor.
Good evening, Omoyemi, and it's good to have you. You were not around last week.
Yes, I miss you.
Good to have you right here.
Yeah. Welcome
To the
back,
program.
Doctor,
Yes.
to the show. Like we said earlier, I mean, like for the past 3 weeks, we've been talking about some ailments, talking about some things, just some health tips. We said today, like, let's just do like a feedback, segment today. Like, let us give the people the chance to also ask their questions and
Yes.
just get back to us. It doesn't have to be on anything we've discussed on the show. It can be something neutral. If you have any other health problem at all that you really want to ask doctor any questions on, this show today is designed for you to have that chance to ask doctor any question at all. And she already came with lots of questions herself that people have been asking her, and I'll let her do the honors by telling us those questions and answering them.
Okay, thank you so much. We're live on Instagram. I'm saying hello to everyone on Instagram. We're also live on Facebook.
Yes,
We're
on
live on
Facebook.
YouTube, and I'm welcoming all of you to the Ask Dr. Rita show. My name is Dr. Rita Jabin, and I say welcome, 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 welcome. And for some time now, we've been talking about kidneys and kidney-related problems. And in fact, it's the question I'm trying to look out for right now. It was here, oh, now. Now. Okay, yes. So we've had quite a number of questions, and I mean, from my inbox on Instagram, I have like 12, Abby, total of 16 questions. Of course, we may not be able to answer all 16 questions, but we'll do the best that we can. We've been talking about kidneys, how to care for your kidneys. Last week, I spent time to talk about things that people eat that affect their kidneys. So if you are listening to us on this radio, you should start calling in with your questions. But okay, so the first question I have here is, first of all, hello, Dr. Rita. What causes frequent urination? Okay, I think I've talked about this, but well, frequent urination can be caused by various factors, and it can be caused by drinking too much water.
Yes.
Drinking too much water may not necessarily mean that you have a problem.
Yes.
Drinking too much water will make you to urinate much more. But then I think this person is not referring to just the amount of water, but then it could be also as a result of conditions like urinary tract infections can cause it in case of diabetes, and then some drugs that someone is taking can also cause it. But generally, it's just that the same urine the person is passing it in smaller bits.
Okay.
So I don't know what this person's case is right now, but of course, usually there are several other factors, but this is
the common one.
The common one. Then I have another question here, which I think I also answered to, but the person here says, what is urinary tract infection? Urinary tract infection is infection of the urinary system, and this includes the bladder, the urethra, the kidneys, and it's mostly caused by bacteria. Someone asked me that does sex cause urinary tract infection? Sex will not cause urinary tract infection unless the person that you are having sexual intercourse with is infected. And of course, that may be happening to a man because a man uses one organ for both sex, but for the woman does not use the same part for both of them. So of course, it may not be, but of course, bacteria can, the way you take a stroll, because say you're tired of sitting down in the house, you just want to stroll to Shakmo. The bacteria in one location will just say, I'm tired of staying, let me stroll to the next opening available. So that can happen in some cases, So, and then the person is asking number 3. Somebody else asking, how can I prevent bladder infections? Okay, so one of the ways to prevent bladder infection, I talked about it last week. One of the things that can make someone prone to having infection is when you have to hold your urine for longer time than normal. You may find yourself that that may give room for that. But one of the ways to generally prevent, ensure that you maintain proper hygiene when you use the toilet, especially for the female. Females are more prone to urinary tract infection than male because of the way the female anatomy is. So it may make them to be prone to urinary tract infection. So in those cases, what should they do? They should clean properly, and they should wipe from front to back, not from back to the front, and then use water. Always good to use, but water is always better than using tissue. if you have to use something, then use a wipes. It's much more better than just using dry tissue,
Mm.
you know. So those are ways
To
that
prevent.
someone
Mm.
can prevent. And
Okay,
then
doctor, before you go on, like let me call the phone lines because
yes, yes, yes,
people
yes.
at home
They are
they also want
waiting.
to ask their
Yes, yes,
questions
yes, yes.
too.
In fact, and I need to even get to YouTube right
Uh-huh,
away to check
uh-huh.
the people
The
who are
questions.
live on YouTube right now and take their questions.
Okay, okay. I can also call us in right here in the studio and ask Dr. Rita your question. It can be any question at all relating to your health
Yes.
that you want answers to. And you can call this a number 0706 171 3985. 0706 171 3985. You can also call 0813 355 3996. 0813 355 3996 to ask any question at all relating to your health that you want to know about. Uh, Continue with the question, doctor.
Okay, thank you. So I have a question here on YouTube. Incidentally, today is my dad's birthday, and I want to give a shout out to my dad.
Oh,
Daddy, I'm sure you are listening to me because I'm seeing a question from him, and I'm saying
mm-hmm.
happy birthday to you. Happy birthday to you, Daddy. I love you so much. So my dad is asking what causes foamy urine. I think I've answered this question before,
Mm,
but I will just say again. But there are several things that can cause foamy urine. Number, it could be as a result of the force or the force of the urine stream.
mm.
It can be as a result of that, or the style of the urination can cause there to be bubbles.
Oh, okay.
But that does not necessarily mean that there's a problem. But in most cases, it's an indication that there is excess of protein in the urine. So that can be as a result of consuming too much protein. Sometimes too, a lot of alcohol residue
Mm,
can cause it, but those usually fade away after a while. But this case of foamy urine that we're talking about that indicates a problem with the kidney is usually as a result of proteinuria. Of course, there are some other things that can cause it, but when the proteinuria we're talking about, the foamy urine we are referring to
mm,
now is the one that has been persistent and is very foamy and has been there for quite a long of time, you know, for a long time now.
mm,
Yes, so that, of course, that is the type that I'm talking about at the moment. And that's usually you will see it with your eyes as you are urinating. You will see that you have foamy urine, and then you would it will be of a concern to you, and sometimes the urine may have a kind of smell or a kind of look
mm.
that will make you know that this is
There's
not how my
trouble.
urine used to be before. You will just notice that my urine, there's a change, and that change is what makes you to um take steps. So someone is asking what test can I do to check for urine. I've also answered this. So I want you to go to my Instagram page. Every day there is a video that I do every day. I mean, this month so far I've done about 15 videos. I do 30 videos every month. And these videos cut across different questions that
Mm,
people are asking. So I have answered this question on my Instagram page. My Instagram page is ask Dr. Rita underscore show, and that is ASKDRRITA. That is
mm,
Dr. DRRITA underscore show. And then for YouTube, ask Dr. Rita show. Facebook, ask Dr. Rita show. You will find the videos there. A lot of the teachings I've done, you can find them on my page. And then yeah, so what the question the person is asking, what are the tests that someone can do? You
mm,
can do a simple urinalysis. Urinalysis is a test where you give your urine. I mean, that's one of the byproducts of
mm.
waste, and that is a test that actually can show you if there's something with your kidney. So the urinalysis is a simple test that looks at your urine, but that is not usually enough. And then you find also that someone can do tests like a renal function test. So a renal function test will check your electrolytes, your urea, your creatinine. Usually, what are you monitoring? You're monitoring the urea and your creatinine,
Mm,
because these are the indication that what is the function of the kidney. One of the functions of the kidney is, there are several functions, but one of the key functions of the kidney that when it's having a problem, causes a whole problem, is the filtration function. You know, when the body, when it's not able to remove this product of metabolism or
mm.
the things you eat from the body. So this is, so those tests would show you
The
whether
problem
the
is,
clearing
mm,
is being done, whether the clearing is not being done, whether it is being done incompletely and it is not done completely.
mm,
And then there's also a further analysis that can be done, which is the EGFR. That will usually tell you what the stage of your kidney is. Usually 90 and above is perfect. That's where you should be, you know. But then some people will find that they have dropped to like 76, some have dropped to 54, some have dropped to 30, to 20. From like less than 15, then there's
There's
something
trouble.
needs to be done
Mm.
about it. And then someone is asking me here, um, what is I think I saw the question. Yes, what is dialysis and when is dialysis needed? I think this is something that I needed to talk about because I've had someone come to my office and ask me, and they say to me that, oh, should I need to go to is dialysis necessary? There's a stage that the urea and the creatinine will be in the body. It means that the waste level is so much. That means that the kidney is not functioning. So what is dialysis? It's a procedure, it's a treatment that does the work of the kidney, which is to filter and remove waste from
Where's
the
what?
body.
Mm.
So when the kidney is not able to do the work of filtration, what happens? It just you need you need to remove those waste.
Mm.
When those wastes are not removed from the body cannot function well. There are lots of other complications that arises. So the person does dialysis. So when is dialysis needed? It's needed when the waste level when it's so high. Sometimes as high as even 300. The urea is high, the creatinine is high,
Mm.
like 300, 400, 500. I've seen someone has come to me with like 3,000 something. So at these stages they would require some assistance. So these things are so dialysis is not a sin, it's an assisted treatment. And then I have a very funny question here, that is dialysis is kidney can kidney problem be spiritual? um
Umi, I want to hear the answer.
okay, so the truth is that while I am a scientist, and I really, even though I'm a naturopath,
Mm.
I'm a holistic expert, I use herbs. I'm very scientific,
Mm.
and that's why you hear me say do test, do test, do test. I don't. I did, maybe because I didn't. My training was not done in Nigeria. I mean, this when I went to school, I did 4 years of study. After I've finished doing another, for this naturopathy.
Mm.
And I remember my professor in the US, you take history, you must send the patient to go and do lab tests. You must come back with laboratory results. But of course, there's not everything that science can explain. There are conditions where we say that these are idiopathic causes,
Mm.
means that you cannot actually pinpoint. You can
The
I
cause. Mm.
there I have a case of a child, well, not a child, the boy was brought to me. He turned 18 this year. He came to me at the creatinine was very high when they brought him to me. Like last year was when I did the consultation, but we started the treatment this year, and he's just 18 years old. How did he come about kidney problem? He's always been having malaria medication, and it
Mm.
just turned out to be that where he went to the hospital, he was in the university and went to the hospital, and they gave him some injections, and he finished the treatment, and then he went back. It became sicker. So he went back to the hospital again, and they ran further tests and found out that he
The
had
kidney problem.
acute kidney failure.
Mm.
So it just came up suddenly. He was not drinking, he was not smoking, he was not, it just happened.
Just shut up.
So in that case, the parents, everybody is wondering what happened. There's no history of that. So these are conditions that happen. Yes, you know, I cannot say that there's no witch or wizard, though. There's witches and wizards, because even the Bible says that there are forces of darkness. So
Mm.
of course, so sometimes there can be a wale, as they put it, hand can be inside.
Village people.
Village people can
Mm.
put hand inside this thing, but they are quite. But then they and just also want to say that sometimes too, people can do everything right, and something
And
will
still
still
end up, yes.
and still.
Mm.
So it's not every sickness that is caused by something that you have done. Sometimes you did everything. Sometimes the problem could be that you were too health
Yeah,
conscious.
yes.
That you're over
You're
health
too
conscious.
careful.
Your body needs some bacteria to be able to do some things. So of course, it's important that we take note that there could be spiritual, but I'm not saying that spirituality is the cause of kidney failure.
Mm.
But it's possible that somebody, I mean, I've also had case of someone who was not hypertensive, was not diabetic, she was not anything. She just listened to a video that I did. I just decided to go and check, and her creatinine was very high, her urea was very high. She was The only thing she used to feel is sometimes she has occasional side pains,
Mm.
and that's just it. She's not hypertensive. She doesn't take drugs. She doesn't take alcohol. She doesn't. She was very surprised. She did the test in 3 different hospital, different locations,
Just to be sure.
just to be very sure. Because even me myself, when I was taking the consultation, I was like,
How did
what
you come about
I
this?
this what and then you find that there are some people who have been drinking, they drink gallon of
Yes,
alcohol,
they are
they drink,
fine.
they are very fine, they run tests, nothing they do them, they are all right. They say na Africa. Sometimes bad things happen to good people, and there's nothing that it's not your fault. You see, it's not like the person did anything. So um could it be spiritual? It's possible, but I don't have a scientific backing for that.
Mm.
So
Okay, we'll just go on this very quick commercial break and return in a moment to call out the phone lines again for you to
hmm?
be able to call us in and answer more questions. Stay with us.
Are you looking for an expert medical advice and personalized care? Now is the perfect time to book your consultation with Dr. Rita Jabin. Here's what you get: a 30-minute consultation for just
I think you should call
25,000 naira, 1 month
your station
personalized
line.
treatment for
Hey,
only
Call it more
60,000
because
naira, a food plan tailored to your needs for just 5,000 naira, plus a free 10-minute bone therapy session valued at 10,000 naira. That's a total of 100,000 naira. But here is the good news: with code Fresh FM, you can get it all for just 80,000 naira. Yes, that's a 20% discount exclusive to Fresh FM listeners. Hurry and call Dr. Rita Jabin today. Call 0706 171 3985. 0706 171 3985. Don't miss out on this expert care. Call now on 0706 171 3985. Remember, first come, first serve. Dr. Rita Jabin, your health, her priority.
thank you so much for staying with us. This is still the Ask Dr. Rita show on Fresh 107.9 FM Abeokuta, and Dr. Rita is still here. We're live on Facebook. You can rush down to Facebook and drop your questions. And we're also live on Instagram at Ask Dr. Rita underscore show, as well as a YouTube page. And we are everywhere, so you can ask your questions. You can also call us right here in the studio. The number to call is 0813 355 3996. 0813 355 3996. If you have any question at all relating to your health, Dr. Rita is here to provide answers to those your questions. 0813 355 3996. 0813 355 3996. Hello, good evening. Hello, good evening. Yes, sir. Thank you very much, sir. You're live.
yes, you are live.
What do we have here? What is your name? What is your name? Where are you calling us from? Okay, from where? Okay,
Okay.
please ask your question. Okay, in the
Okay.
night.
Okay, Mr. Sheyi, thank you so much for your question. Um, so there are several factors that can be causing frequent urination. There are questions that I will need to ask. Are you
Mm,
diabetic? Are you on some drugs? Is it the water you're taking? So I want you to take advantage of the present combo that we're offering, Mr. Sheyi. I hope you can hear me. I want you to call my line 07061713985. Now you have asked a question that has plenty questions that you
mm,
need to give me answer to. You could be urinating very frequently as a result of diabetes. I do not know if you are diabetic. It could be as a result of the water you are taking. I do not. It could even be as a result of prostate, because when there's inflammation of the prostate, because of the location of the
mm,
prostate gland just at the tip of the bladder, it will stimulate the bladder to cause them to have frequent, so the person is not voiding completely.
mm.
So it's the same, maybe 1 liter of urine, you are passing it small 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 small. It could be as a result of prostate. So Mr. Shea, I want you to call my line immediately after this program and take advantage of the combo that I have. The offer is for, it's not only for kidneys. So I must say, because quite a number of people were
Yes.
like, is it only for, so that offer is for you that you are listening to me. So you get a 30 minutes consultation. The consultation can be done online, or if you're not in Abeokuta, or if you're very far away, because I realize that the radio station is
Yeah,
cuts
yeah,
even from Lagos,
yes.
so from far away, you can have your session online, or you can come to the office. Whether you come online or you do physical, it's still going to get you the result. Then after that, that is when you now get a 1 month treatment based on what we have isolated as the diagnosis. Then we now get a list of what to eat or what to avoid. For this combo, I said you get it for how much?
80,000.
80,000 naira only for Code Fresh FM.
Fresh FM people
And that's for this month. Yeah, so Mr. Sheyi, I hope I've answered your question. So I have a question here from YouTube. Okay, so this person asking this question is my mom. Okay, mommy, all right, I can see you. Thank you for logging in. So what are the food to eat what are the best food to keep a healthy kidney? Doctor, you are doing a great job. Thank you very much, ma. So what are the foods that you can eat? One of the things I would say to you is that reduce your salt intake. And not just the salt intake from the soup you are eating, the cumulative salt you take. You see, there are some food that are nuts that are coated with salt, some snacks that are coated with salt. So someone can tell you they are not eating plenty salt from their food, but they will eat Pringles that have salt. They will eat cashew that have with salt. Yes. All these salty things at the end of the day. So you need to cut down on your salt intake. Another thing that you need to do to check for your care for your kidney is to check your blood pressure. It's very important. You have to check your blood pressure. That is one thing that you must do. Then foods, plenty of fruits, plenty of vegetables, reduce oxalate food. So when we come the next episode, next time when I'm going to be on air. By the way, I'm not going to be on air for some time because I'm not going to be available, but you can catch me live on Instagram, Ask Dr. Rita Show. You can catch me live on YouTube, Ask Dr. Rita Show, because I don't have to be in the radio station to go. Those I can do that from wherever I am, you know. So you can catch me live on next week Tuesday on Instagram, Ask Dr. Rita Show, and on YouTube, Ask Dr. Rita Show. But when I come back on air, I'm going to be dealing with allergies. If you have a question, we can say, I'm going to be dealing with allergies because you too, girl, have allergies. Yes, you know, allergies versus reactions. I'm going to be. Yes, please.
Hello. Oh, okay. Please go ahead. Your BP.
Sir, please come to the office, please. Your condition cannot be addressed on the radio. Please take the number 070 61 71 3985. Take advantage of this combo now and come to the office. You will get 30 minutes consultation with me. You will get 1 month treatment. You will get a list of what to eat and what not to eat. With this blood pressure that you have just called out, you need to come for a consultation session. It's too much.
It's too much.
Yes.
In case you have questions to ask Dr. 0813-355-3996, 0813-355-3996, and a direct line is 0706 171 3985, 0706 171 3985. As you very should not be around for a while, so take advantage of this opportunity.
Yeah, so I'm not around to be live on radio. Yes, you know, so that's the thing. I have to only it's only when I come to Fresh FM studio that I cannot be live from far away. You know, so that's the challenge. But when I come back, I'll be back live on radio. So I have a question here. So I was talking about I'm saying now, stay away from oxalate food.
Yes.
When I come next time I'm on air, I want to talk about live food and dead food, and food that contains this oxalate, and then food that triggers allergies versus immune disorders, because quite a number of people have allergies, and these are conditions that they are not even aware of. And then I was asking, have you done allergy tests? And looking at me like, what's in the allergy test?
I think I'm going to do allergy test now. I don't know what they do.
You know, yes. So I have a question. How do one know one's kidney needs to be cleansed? Well, it is through tests that you will know, because the truth is that the kidney is one of the organs that until it is far gone, you may not know that there's anything. Sometimes there are no symptoms. So a test, what are the tests? I've listed the tests to be done. If you go to my page, you will see there is a video I did last week on tests to do. and what to do after a test. And if you did a test, if your test was saying something, what it means. I literally explained the different test points and what the indications are. So go on Ask Dr. Rita Show on Instagram and watch it and get it. Now, so how do you know that your kidney needs to be cleansed? I'm not a magician, but you see, that's why we have the combo, which helps you that, okay, so if we now find out that there's a problem, okay, fine, we can now help you, you know. And but be sure, rest assured that I don't do gbogbo nishe. You know, gbogbo nishe means that you just have one concussion that deals with everything. No. You will do tests. You must go and do tests. I mean, I remember there was a time when someone went to meet my parents and was like, hey, tell your daughter. My mother told the person that, you see that my daughter, if you like stretch on the bed like this and be shivery, she will not tell you go and do this or go until you do test. I must see results, because I have seen people assume that it is pimples, only for us to go and do test and find out that it is something else, you know. And then the test also helps us to know what is the therapeutic dosage that your body can tolerate, because before I give you anything, I must see your liver function test. And that's also another thing that we're going to be looking at. We have looked at the kidney now. We're also going to be looking at the liver and how to care for your liver, the foods that you eat, and the ways to ensure that, because you cannot afford to have, nobody go donate liver for you. Everybody get one. You know, so we had a vox pop that was done, and people were asked in Abeokuta here, do you know, they asked people, where is your kidney? The person say kidney is in the heart. Kidney is not heart. Kidney is not in your chest. Kidney is at your back, behind your side like this. It's there. It's two. And then they ask somebody, how many kidneys you have? You say, I don't know. It is two. Everybody has two kidneys unless there's a congenital abnormalities. But of course, your body can survive with one kidney. That's why you can donate. Someone can donate one kidney to another person. But for the kidneys, oh yes, the both kidneys are. Everybody has two kidneys and it's located at the back. And not having sex cannot affect your kidney. Because I have men, they ask that question. Person, and a man now, they are very concerned about their libido. The average man, the only problem that we get a man out of his house to look for solution is libido problem, unless the problem has whined his liver, whining very well that it's in so much pain. But at least they affect libido. So we're not doing.
Okay. Well, to talk to doctor, like she said, I mean, even if she won't be here right here in the studio, she will be everywhere on social media. You can always talk to her. You can always catch her up on our YouTube channel at Ask Dr. Rita, also on Instagram at Ask Dr. Rita Show. And the number to call, a direct number, is 0706 171 3985. 0706 171 3985. Doctor, your part in short, our time is almost up.
Yes. So next week, so I'm wrapping up. I've wrapped up with the kidney cases, but I've said that when I come on air, I'm going to be talking about allergies and immune system, versus allergies versus immune system. But next week, I'm just going to do a wrap up of this on live from wherever I am. You know, so I'm going to be talking about the food that you eat that can cause excess of it, that can give you kidney stones, that can cause you to have stones. So you don't want to miss it. So make sure that next week you tune in, Ask Dr. Rita Show on Instagram and on YouTube. And then you can call my number 070 6171 3985.
Thank you so much, Doctor.
Thank you.
And that's the title of the program for tonight. I will catch you up later on. Enjoy your evening.
Thank you so much. Thank you. Bye.
Bye for now.
Bye. Bye on Instagram. Bye on YouTube. Bye.
Very low. Very low. All day.